Hey, what's up everyone? Dr. Beau here, and today we are talking all about disc herniations and can chiropractic help? Stay tuned.
How can I help you today?
All right, so a super common question that gets asked to me a lot is, Beau, can chiropractors help with disc herniations? And the answer is maybe, potentially, yes, and sometimes no. So let's talk a little bit about it and give you guys some treatment options, because I guarantee someone right now is watching this and debating, should I go to a chiropractor, should I not, what have you. So quick review. This is your spine. This is the lumbar spine, and that big red thing that you're seeing right there is what would be perceived as a disc herniation. What a disc herniation is, just so you guys know, is you have two bones, and in the middle of it is a vertebral disc, and for some reason, that vertebral disc has been shortened and pushed down. Matter of fact, I explain it to my patients like a jelly donut, meaning if you push down on the jelly donut and the jelly donut starts to bulge out, that is considered a disc bulge. If it pushes out even further, that's called a disc herniation. All right, so the question is can chiropractors help or not? Now, a couple of things to kind of talk about. First off, many people have disc bulges and are completely, what they use the term, asymptomatic, which means they don't even know that they have it. Matter of fact, they typically will go to the doctor with another issue and then realize, oh look, you have a 1 millimeter disc bulge or a 2 millimeter disc bulge at a site of your lower back that is not the area that you're even there to check out. So, number one, yes, it's common. Number two, is it a death sentence? No. Is it an automatic, you're gonna have surgery? Again, no. What we are looking for is a combination of two things. Number one, is it symptomatic? And if so, what size is the disc bulge or the disc herniation? Now, when we talk about size, if you have gone to your doctor and had an x-ray or an MRI, and by the way, MRI, guys, is the way that disc bulges and herniations are actually diagnosed. We can only see bones on x-ray, so you have to have an MRI to actually measure the amount of bulge or movement of the disc, because on MRIs we can see soft tissues, but on x-rays we cannot. So with all of that being said, I'm gonna grab my little guy back up here, and as you can kind of see, there's a big old bump sticking out right there, right? So that would be the disc bulge or the disc herniation, and it is measured in millimeters. So a disc that has a bulge of less than 3 millimeters is considered a mild disc bulge. 3 to 5 is considered moderate, and then 5 and over is considered severe. Now, they change those parameters a little bit here and there, but for all intent and purposes, those are kind of the tried and true overall. So if a person comes into my practice and they say, Beau, I have a mild disc bulge at the L5, which is basically the one you just saw, can chiropractic help with it? My next question is what symptoms are you having? Meaning this. When we look at your back here, if there's a bulge there, but it's not pressing on any of the nerves of the area, you're not going to experience numbness and tingling or pain down the legs. However, even if the disc bulge is small, but if it is pressing on that area, then you will experience the numbness and tingling, what we call radiating pain. Typically, people start to experience radiating pain when it hits the moderate level, which means 3 to 5 millimeters. Now, for all intents and purposes, can chiropractic help out with all the ranges? The answer, again, is maybe. In my practice, and from what I have seen and the experiences that I have had with my patients, here's what I've kind of typically seen overall. If you have a mild disc bulge, meaning 3 millimeters or less, about 75 to 90% of the time with conservative chiropractic care, which means we're going to be adjusting stretches, exercises, flexion, distraction, those types of things, we will see a reduction in symptoms, if not a complete resolution, which means the disc will actually move, or they call reabsorb, back into the right place. How long does it take? Well, I tell my patients when they come in, no matter what stage that they're at, we are going to do a trial of care for approximately 2 to 4 weeks, and then we are going to do another assessment. Now, assessments are very subjective based upon the doctor that you're seeing. So you could put them through different orthopedic tests. We can have them do strength tests. We can have them do ranges of motion, different things to try to provoke the radiating pain or the area of complaint. What we want to see, at least what I want to see in my practice, is that within 2 to 4 weeks that those symptoms that they originally entered into my practice have been reduced by a minimum of 50%. If we're seeing a 50% reduction, then we are on the right path and will continue care. However, if we're seeing no reduction of symptoms, then I also want to work with their medical doctor, orthopedic surgeon, spine surgeon, whoever they're working with, to create a different game plan or a different assessment, or maybe try different modality of care, meaning the way we adjust them or the way we're doing physical therapy. So again, if you're in a mild disc bulge, less than 3 millimeters, like I said, we typically as chiropractors have about a 75 to 90% reduction in symptoms and help with resorption. Again, this is just what I'm seeing in my personal practice. Other doctors may be better, other doctors may be a little bit worse, but for my all intents and purposes, with the patients that I've worked with, those are kind of my standards. Now, if you are higher, meaning you're between 3 and 5-ish, then I tell people it's typically about 50-50, meaning 50% of the time we're gonna have those same reduction of symptoms. We're gonna continue to do, we're gonna see the body get better. We're gonna see big changes. Now, sometimes it takes a little bit longer. It may take us 4 to 6 weeks, but once we kind of get the ball rolling, if it's working, it's working. And if it's not, we're not gonna see a big change. Now, if you have severe, meaning higher than 5, which is usually like 6 to 8, of a disc herniation before they call sequestering, which means that's the disc stuff actually came out of the disc. That is when it gets really, really dicey, meaning we may or may not, and I tell my patients, I've had just the other day, a patient came in, they got a 7 millimeter disc bulge at their L5-S1. And I told the patient, hey, look, this is a very significant disc bulge. And they've told me, Beau, most of these patients have already been to multiple doctors. They may have had injections before. They may have been on multiple medications. And they'll say, I'm trying anything before having surgery. And I will tell them, look, in this situation, I'm willing to do some conservative care, but only, like I said, between 2 and 4 weeks before we measure if there's any reduction. Now, in these situations, there's only about a 20 to 30% chance, at least again in my practice, where we're going to see it resolve. So you're not on the right side of history, so to speak, as far as how things traditionally have taken place. But most of those patients at that point are pretty desperate. And they're saying, I will try anything. And to be honest, I would do just as well. I would try every avenue: chiropractic, massage, acupuncture, physical therapy, injections, medication, anything to avoid surgery. Why? Because surgeries, especially like this, are only 50-50, meaning I've seen lots of surgeries where they go in there, they'll take the disc out or they'll trim it, and the patient will continue to have pain, they'll continue to have issues. Now, am I saying that surgery is a bad option? No, I'm not. What I'm saying is that it's another option. But before you go into an invasive procedure like a surgery, again, try all of the conservative care out. Now, again, lastly, with my patients, like I said, I'm very upfront and clear with them. And I think if you're watching this, this is what you're looking for. Number one, how big of a disc bulge are we looking at? Is it mild, moderate, or severe? Is it less than 3, 3 to 5, or over 5, usually 5 to 7 to 8 before it sequesters and comes all the way out? And by the way, if it's sequestered, meaning the disc, the inside of the disc, the jelly called the nucleus pulposa came out, that's a surgical case. You have to go get that one taken care of because there's bigger long-term effects when the disc actually pops out and the nucleus pulposa comes out. So that's a surgical case. But if you're less than that, kind of understand your percentages. Hey, look, around 3 millimeters, yeah, I got a 50 to 70% chance of it going really, really good. When we start talking 4, 5, 6, yeah, 50-ish. Then 6, 7, 8, all right, guys, there's only about a 20-25% chance that this thing's going to turn around. And like I said, I think when you're talking about chiropractic and stuff, we have decent success, but you just need to have your eyes completely wide open going into it. Last thing I'll tell you is this, is that there is a specific type of care for those patients that have very severe disc herniations, and that is called mechanical traction. Matter of fact, there's whole chiropractic clinics built upon what they call spinal decompression. If you're at the point where you're like 6 to 8-ish, somewhere right there, and you're considering looking for a spinal decompression specialist, and they use these big machines that you get up and you lay into, and it actually decompresses and opens up your spine for a prolonged period of time. They're big, they're expensive, just so you guys know. Insurance typically doesn't cover it, but I have seen some pretty miraculous stories come out of those. So guys, if you guys are experiencing a disc herniation, if you have questions about it, please let me know down here in the comments. If you guys subscribe to my channel already, you'll know that I go in there and I answer pretty much all the comments unless they're just completely wacko. But I'm here to help you guys, so that's why I do this. So if you have a disc herniation, ask. Hope this is clear. Again, I'm giving you guys just my insights as far as the things that I see in my practice, but I hope someone out there is watching this and it helps. All right, I'll talk to you guys soon. Bye.